first of all, what are some of the risk factors for vitamin D deficiency? These generally go into non-modifiable and modifiable risk factors. So one of them, non-modifiable, is age. The older people are, the general rule, the less well they will synthesize vitamin D. Being female, having darker skin tone equals built-in sunscreen. So sun exposure, you just don't make as much vitamin D compared to a lighter skin tone. Anti-epileptic therapy. Now, I probably should have been a little bit more exact on that. It's not all of the anti-epileptic drugs, but it's a number of them. Any kind of malabsorption like inflammatory bowel disease or cystic fibrosis in burns. Now, modifiable risk factors, obesity, increased amounts of adiposity can contribute to less synthesis of vitamin D. Little dietary intake of dairy. Dairy products like cow's milk products are not inherently replete with vitamin D, but the vast majority of them are vitamin D supplemented. And that's something that started decades ago. And the reason for this was recognizing that lots of the population was vitamin D deficient, recognizing that a good part of the population does consume dairy products on a regular basis, and that this would be one way of getting more vitamin D into a human being. And to give you an idea, is generally it's a fairly small amount of vitamin D in a dairy product, but it's there nonetheless. Not taking vitamin D supplements. You know what? I have a hard time making the argument against routine use of vitamin D supplements. I believe there are only a handful of people in this country that wouldn't benefit from them. Less outdoor physical activity, because where should we synthesize most of our vitamin D? From exposing our skin to the sun. Sunscreen use, and wearing clothing is a risk factor for vitamin D deficiency. Well, I'm a big fan of wearing clothing when outside. So you could see that some of these, when you look at things like sunscreen, I sunburn and I have a family history of melanoma and a personal history of basal and squamous cell carcinoma. I'm wearing sunscreen. I know it reduces my ability to synthesize vitamin D when I am outside, but sometimes I will go outside in during the better weather around where I live with shorts on, but no sunscreen on my legs. So at least I'm trying to synthesize some vitamin D one way or another. But I am going to be wearing clothing. What about non-patient factors? Higher latitude. And so that would be if you are at least north of the equator. That would be the more to the north you go, the thinner the sun's rays are. The seasons of the year, obviously, in the winter months, it doesn't matter where in North America you are, the sun's rays are less powerful. Lower altitude and more cloud cover.